Hello, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks. 2012 is shaping up to be a dynamic year for healthcare. The Supreme Court is going to rule on the constitutionality of the Patient Protection and Affordable Care Act. Hospitals and other providers are trying to transition to a value-based delivery system that puts a greater emphasis on outcomes. Medicare and Medicaid budgets are in the crosshairs. And hanging over all this, the presidential elections. So it should be a very busy year for Teri Fontenot, the new chair of the American Hospital Association's Board of Trustees. Teri, who is also president and CEO of Women's Hospital in Baton Rouge, Louisiana, joins me today to talk about some of these issues that will face hospitals in 2012 and her priorities as chair. Teri, thanks for joining me.
Thanks, Matt. It's my pleasure.
So I want to start by talking about some of the policy debates that will be going on while you're chair of the AHA for 2012. Obviously, the budget cutters in Washington have set their sights on Medicare budgets and hospital payments. I don't know that those can be averted, but what can the AHA and hospitals do to at least minimize the impact of those cuts?
Well, hospitals for years have been trying to figure out ways to improve care and simultaneously reduce waste and thereby reduce cost. So this is really nothing new for us. It gets a little tiring when year after year, session after session, we seem to be the target of additional cuts. At the same time, we're expected to provide more services, medical and non-medical, to patients. So we will continue to do what we need to do to make sure that patients are getting the absolute best care, but at the same time, we need to be very vigilant and engage the entire field in helping us explain to our congressional delegation and other policymakers how important it is that health care be funded at an adequate level.
And do you think that this year there's going to be a heightened sense of that need for advocacy and grassroots efforts?
There's no question about that. We've got to be very unified as a field. We need to speak with one voice. And we're hopeful that this will be the year that we will be able to be on the offense rather than the defense. The enough is enough slogan that we had last year, I think, served us very well. But we really need to make sure that we are eloquent in being able to explain to the folks that are making those decisions that we're already doing a lot of things. We are looking at ways to be more efficient. We are spending millions of dollars on health information technology, which will help us be more efficient. But those things come with a cost. They certainly have many benefits, but they come with a cost, and adequate funding so that we can continue to add those types of back office services are going to be critical.
The Medicaid budget is obviously another area that hospitals are feeling the pinch. You run a safety net hospital. State Medicaid budgets are really in trouble. What impact is that having on hospital operations?
Well, it certainly has an impact because every year our costs increase, and every year we see at Women's Hospital, who is Medicaid's our largest payer, we see them reducing our payments. So it's very difficult to try to balance providing the needs that this particular patient population, who has so many needs, some medical, some not medical. They're very vulnerable. They have complex medical conditions often. But to find ourselves having to try to do more with less or do better with less, and we know that it's not just healthcare that's in that particular predicament, but we are working very hard to make sure that our lawmakers, in fact, we have our legislative delegation at Women's Hospital today touring our NICU, so that they can understand exactly what it means to have a baby in the unit that's premature, has very complex medical conditions, because our state is looking at reducing payments for NICU care. Last year, 43 states cut their Medicaid payments to providers, and this year there are 46 states that are planning to do the same. In Louisiana, we're looking at a 1% to 3% additional cut while costs are going up. So I think education at the hospital level, with our employees, our nurses, and our physicians, telling the story and making it very personal, making it very poignant and personal rather than talking about it in the abstract, really resonates, we find, with our legislative delegation.
Do you worry about the survival of safety nets in that kind of environment where state after state is cutting Medicaid reimbursement?
Well, certainly that is a concern when, again, the largest payer generally for safety net hospitals is Medicaid or some government-funded program, maybe it's tax-based. What most hospitals are having to do is reduce services. They're reducing the size of their emergency rooms. They are eliminating some specialty services or outreach services, and those patients end up in the emergency rooms of private hospitals. So not only does it affect the mission of the safety net hospitals, but it also financially impacts in a negative way the private hospitals.
Terry, you said a couple times here, you talked about cost containment and being more efficient. And we know from talking to other CEOs that they're looking to trim 20% or so out of their budgets to maintain current operations. Tell me what that does to staff morale, how you keep people going forward when you're looking to reduce costs at such an accelerated rate.
Well, it certainly is a concern. Staff are expected to do so many things these days compared to 10 years ago even. They're expected to be very computer literate. They're expected to care for patients who are much sicker than they were several years ago. The technology that goes along with providing care to patients, either clinically or otherwise, is very complex. So we've really put a lot on our employees the past few years. But I also find that employees are very resilient. In our organization, we try to be as transparent as possible. We make every opportunity that we can to ask our employees for their own ideas and suggestions. We don't really feel that we should have any secrets about what is going on either financially or otherwise at Women's Hospital, and I suspect that most other organizations are doing the same. So what I have found in my own organization is when employees are included and they feel valued, and when you've hired the right employees that are really focused on the patient, then they understand that change is just part of our field, and it's something that we just have to learn to embrace and to try to take advantage of and be the change agents for our organizations. And it shouldn't just be at the executive level, it needs to be throughout the organization.
So at Women's, have you guys looked at Lean or Six Sigma as a way to get employees more engaged in the cost containment discussion?
Actually, we have. We have done a few rapid improvement workshops. We did it on some clinical pathways, and they were very successful. We are planning to move into a completely new replacement campus in June, so we are not doing it in a much more integrated way until we move into the new campus, but that will actually be our strategic priority once we move.
I wanted you to put on your financial hat a little bit. You were a former CFO, so we see a lot of venture capital firms and for-profits moving into healthcare these days. What impact is that going to have on the field overall?
Well, I think it's very threatening to some organizations who feel that that may be their only option. But for other organizations, it provides a source of capital. And the fact that for-profit and venture capital firms, to me, ought to be encouraging, because that means that those organizations who are in it for the business, and I don't say that in a critical way, but the fact is they see some opportunities. So to me, it's a pretty strong signal that healthcare is alive and well, and it is a growth industry.
You run a specialty independent hospital. We're moving into an era of accountable care or care coordination, integrated care, whatever phrase you want to use. What role will the independent hospital play in that movement towards accountable care?
Well, in our instance, we obviously don't provide all aspects of care. We focus on women and infants care. So we see ourselves as contracting or being a part of a larger organization that will be able to provide those types of case management services. We currently provide some case management and preventive and wellness care, but it's specific to prenatal patients, to NICU graduates, and breast cancer patients.
And is that the recommendation you would give to other independent hospitals, is to look for ways where they can partner with a larger system?
Yes, I think so, but partnering can take many forms. It can be a loose affiliation, it can be a complete merger or consolidation. The main thing, I think, is to look at what your unique market offers you and where the opportunities are, and then figure out what works best for you. There's really not a best fit for every organization that's standard. We just need to look and see what makes sense for your particular situation and your opportunities. And
lastly, Teri, I wanted to ask you, at the end of the year, at December 31st, 2012, what do you hope to look back on as your time as chair of the AHA? What will be the hallmark of your chairmanship? Well,
I hope that it will be that we moved quickly down the path of continuing to focus on performance improvement, accountability, and transparency. I'm very excited about the movement that's underway. I think it plays very well as the next phase to our efforts several years ago to set up a framework for what needs to happen in our sector, regardless of what happens with the Affordable Care Act or the Supreme Court decision. We know that we can all do better. We've seen that through data sharing and through working closely with our medical staffs and others that help us take care of patients. So I'm hopeful that this time next year we will feel like we've accelerated the pace, that we've been able to embrace some of those opportunities and activities. And then the second thing would be that every member of AHA has become involved in what we need to do. There are many different roles, all the way from governance, participating in councils and regional policy boards and task forces, to participating in the webinars, asking questions, giving us suggestions, and then on the advocacy side, just getting involved at their level to make sure that their constituencies know what they're about and how important they are to their communities.
Well, great, Teri. I appreciate you taking some time today to join us.
Thank you.
And I'm Matthew Weinstock for Hospitals and Health Networks. Thanks for tuning in.